Next on Primary Care, racism and health. Research shows that centuries of racism in this country has had a negative impact on the physical and mental health of African Americans. Hello and welcome to Primary Care, where on each week we focus on topics relevant to the health of African Americans. I'm Dr. Lonnie Joe. Today's show is part 2 of our discussion on racism and health with Dr. Camara Jones. Dr. Jones is a family physician and epidemiologist whose work focuses on the impact racism has had on health and well-being of this nation. She is a past president of the American Public Health Association and has taught at the Harvard School of Public Health, the Morehouse School of Medicine, and the Rollins School of Public Health. She also served as a medical director at the Center for Disease Control and Prevention. Dr. Jones, we are honored again to have you to continue our discussion on racism and health.
Honored to be here.
Camara, you have a story where you illustrate 3 levels of racism: institutionalized, interpersonal, or personally mediated, and internalized. You call this story The Gardener's Tale, and I believe it will help our viewers understand the levels of racism and how it turns into poor health outcomes for African Americans.
Yes, well, thank you for inviting me to share that story, which is actually 25 years old. But before
wow, that old now, huh? We're getting old.
Oh, I shouldn't have said that. But yes, it is, and it's actually being shared at all different levels of education and the like. But before I even share that story, which is very important, I want to say that if people listening right now don't get anything else out of our conversation, I want you to understand that there are 4 key messages when we're talking about racism. The first being that racism exists. The second, that racism is a system. The third, that racism saps the strength of the whole society through the waste of human resources. And the fourth, that we can act to dismantle racism. So this allegory, which is my first allegory, as I said, it's probably 25 years old, is to help us understand 3 levels of racism, and particularly that racism is a system, and if we're going to set things right, we need to address racism at the systems level. So let me define the 3 levels first before I tell you this story. Institutionalized, or what we might call today structural racism, is the system, the constellation of structures and policies, practices, norms, and values that all together result in differential access to the goods, services, and opportunities of society by race. This is the kind of racism that doesn't require an identifiable perpetrator, because it's been institutionalized in our laws, customs, background norms. This is the kind of racism that shows up as inherited disadvantage or its reciprocal inherited advantage. And we see it in terms of material conditions, access to power. The main things I want to say on here, the main lessons I would say, are that it doesn't just so happen that people of color in this country are overrepresented in poverty, while white people in this country are overrepresented in wealth. That is not just a happenstance. For each marginalized, stigmatized, oppressed group of color, there's been some initial historical injustice which is being perpetuated today by present-day contemporary structural factors in our structures, policies, practices, norms, and values. This is what people mean when they say structural racism. The other thing is to say that this level of racism, institutionalized or structural, can show up as acts of doing things, commission, as well as acts of not doing things, acts of omission, and very, very often, this level of racism, structural, institutionalized racism, shows up as lack of action in the face of need. The second level of racism, personally mediated racism or interpersonal racism, I call it personally mediated because I'm clear racism is a system, and so this is the system mediated through people. This level I define as differential assumptions about the abilities, motives, intents of others by race, and then differential actions based on those assumptions. This is what most people think of when they hear the word racism. Somebody did something to somebody. The third level of racism, internalized racism, I'm going to define here from the point of view of members of stigmatized races as acceptance by members of stigmatized races of negative messages about our own abilities and intrinsic worth. I acknowledge that that people who are living as white in this country have internalized racism that shows up as an internalized sense of entitlement. So I will mention that too, but I, in my story, am going to be illustrating internalized racism from the point of view of members of stigmatized races. So here's the story. This story, which, like most of my allegories, my teaching stories on different issues of race and racism, is based on something that happened in my own real life. So let me tell you what I saw with my eyes, and then I'm going to make it a story about racism. My husband and I had been married about a year when we moved down to Baltimore, where I was going to finish up my PhD at Johns Hopkins, and we bought our first freestanding house. Cute little house with a big wraparound porch with flower boxes dotted all on the porch. We bought this house in October. That's not really the time to plant in Baltimore, so we waited until spring. But when spring came, my husband, who loves to garden, he ran out with our marigold seeds, going to decorate our cute little house. But then he came right back in because he said, "Camara, some of these boxes have dirt, but some of these boxes are empty. I need to go to the gardening store." So he does. He goes to the gardening store and he comes back hauling big old bags of potting soil. And then we fill up the empty boxes. Then we take equal numbers of our marigold seeds and put them in all the boxes. And then we water all of the boxes the same. And by this time, because I am not the gardener in the family, I was exhausted, right? So I figured I'm just going to sit back and become delighted, right? I stopped being involved in the gardening. But 3 weeks later, when I walked out of my front door and onto my porch where these flower boxes are, I finally paid attention to these flower boxes, and what I saw made me literally stop in my tracks, because what I saw made me think that we had planted completely different seeds in some boxes versus others, because some of the boxes were full of plants and they were tall, vigorous looking plants, but other boxes just had a few little plants in them and they were kind of scrawny and scraggly looking. And then I realized what had happened. That potting soil that my husband had bought turned out to be rich, fertile soil, so that every single seed planted in that rich, fertile soil had sprouted. The strong seed had grown very tall and vigorous, but even the weak seed had made it halfway up. But that old soil that we had found there turned out to be poor, rocky soil. So the weak seed planted in the poor, rocky soil just died. And even the strong seed in the poor, rocky soil had to struggle to make it to a middling height. And maybe some of you all listening to my story so far are nodding, because maybe you're gardeners and maybe you've composted half of your garden. So maybe you've seen this image with your own real eyes. And the image, of course, is about the importance of the environment, the importance of the soil. But now I'm going to take this image and I'm going to make it a story about racism by introducing a gardener. So now we have a gardener who has two flower boxes, one which she knows to have rich, fertile soil, and one which she knows to have poor, rocky soil. And she has seed for the same kind of flowers, except some of the seed is going to produce pink blossoms and some of the seed is going to produce red blossoms. And the gardener prefers red over pink. So what does she do? She takes the red seed, puts it in the rich, fertile soil, pink seed in the poor, rocky soil. 3 weeks later, she sees in her flower boxes what I saw in mine. In that rich, fertile soil, all the red seed sprouts, strong red seed, tall and vigorous. Even the weak red seed makes it halfway up. In that poor rocky soil, the weak pink seed dies. Here comes the strong pink seed struggling to make it to a middling height. And then in those two flower boxes, those flowers go to seed. And the next year, the same thing happens. And then those flowers go to seed. And year after year after year after year, the same thing happens till finally, about 10 years later, the gardener's looking at her flower boxes and she says, "You know, I was right to prefer red over pink." So let me interrupt the story here to say the first part of this story is how structural or institutionalized racism works, where you had the initial historical injustice of the separation of the seed into the two types of soil. You had the contemporary structural factors of the flower boxes keeping the soil separate, and then through lack of action, inaction in the face of need, perpetuation of the inequity. But let's pick the story back up to say, well, where would personally mediated racism be in the garden? Well, the gardener's looking over at the red flowers thinking, "Oh, red is so beautiful," and just loving the red. And then she looks at the pink flowers And she says, those pink flowers sure are scrawny and scraggly. So she plucks off the pink blossoms before they can even go to seed. Or maybe she notices that a pink seed has blown into the rich, fertile soil. So she plucks it out before it can establish itself, which is some of the anti-affirmative action stuff we see. And where would internalized racism be in this garden? Well, the red flowers are just living their lives, enjoying being red, many of them not acknowledging or perhaps not even understanding that they're benefiting from enriched soil. The pink flowers are looking over at red, thinking red is mighty fine and wishing with all their hearts that they too could be red. And here come the bees, minding their own business, collecting nectar, but pollinating at the same time. So here comes a bee, bzz, into one of the pink flowers, and then bzz, to another pink flower, and bzz, to this pink flower. This flower's like, get away from me, bee. Don't bring me any of that pink pollen. I prefer the red, because the pink flower has internalized that red is better than pink. So now the question arises, what do we do to set things right in this garden? Well, you might say, okay, let's address the internalized racism. Let's go over to the pink flowers and say, pink is beautiful, power to the pink. And that is an important intervention indeed. But if that's all we do, it's not going to change the situation in which the pink flowers find themselves. So you might say, oh, okay, well, let's address the personally mediated racism. Let's have a conversation with the gardener, or better yet, let's have a workplace multicultural workshop for the gardener, which is all good. So we do. And in our workshop, we say, dear gardener, would you please stop plucking those pink flowers? Maybe she will, maybe she won't. But even if she does, it's still not going to change the situation in which those pink flowers find themselves. If we really want to set things right in this garden, we must address the structural or institutionalized racism. We must break down the boxes and mix up the soil, or if you want to keep separate boxes, that's all right too, although it does make it easier for that same gardener to continue segregating resources going forward. But if you keep separate boxes, what we need to do right now is we need to enrich that poor rocky soil until it is as rich as the rich fertile soil. And when we do that, the pink flowers will flourish. They'll be looking beautiful, grand, and glorious. So that in that intervention on the structural racism, we will have also addressed the internalized racism, because now pink will no longer be looking over at red thinking red is better or wanting to be red. And in the intervention on the structural, we may also address the personally mediated racism. Now, the original gardener may have to go to her grave preferring red over pink, but her children who grow up and see the flowers equally beautiful will be less likely to have this kind of attitude. So this story has been to illustrate those three levels of racism that I briefly outlined before: the institutionalized or structural, the personally mediated or interpersonal, and the internalized, and to very strongly suggest that if we want to set things right in this garden, we must at least address the structural racism. Good to address all the other levels at the same time, but at least address the structural racism, and the other levels may take care of themselves. Now, before we even go to any other questions, I have to say that my story is incomplete, because I have not, there's one question, huge question that we haven't even asked yet, which is, who is the gardener? After all, the gardener is the one that I gave the ability, the power to decide, the power to act, control of resources, which are actually the elements of self-determination. Who is the gardener in our U.S. context? Well, the government is a huge part of the gardener, but not the only part. Media, foundations, corporations, communities, to the extent they have self-determination. But whoever the gardener is, it is dangerous when the gardener is allied with one group. If you saw how I illustrate my little story, I paint her red. That's why she prefers red over pink. And it's also dangerous when she is not concerned with equity, when she can look at her flower boxes and think that her garden is beautiful, thank you, because she's not even counting the pink flowers as part of her garden. So the question is, what do we need to do to, about the gardener? Do we need to make the gardener striped, polka dotted, fuchsia? Many, many questions can arise out of this story. And so would love to hear some of your questions, Dr. Joe, or happy to share some other questions that I've heard over the 25 years that I've been telling this story.
Well, Dr. Jones, since we are experiencing the COVID pandemic and the resurgence, all of a sudden now the garden is affected equally by something called COVID-19. Okay, how do we respond to that? Not that COVID-19 brings a special medical issue or anything. We handle that portion of it. But how does any disease state, how does any crisis brought to the garden now affects the outcomes?
Well, let me tell you, it's a multi-step thing. The initial recognition of the disproportionate impact of COVID-19 on communities of color was a surprise because we knew that this was a new virus, right? That no human on the earth was immune to this virus, before December of 2019, right? And therefore, if there were no, if opportunity were equally distributed, right? If exposure to risk were equally distributed, there would be no way that we would be able to slice and dice the population and find differences in the numbers of people getting infected, the numbers of people being hospitalized, and the number of people dying. So when we saw back in March and April, we started seeing the disproportionate impact, of COVID-19 on communities of color in, New Orleans and in Detroit and in, Milwaukee was the first one to document that, and it's Chicago and so many cities, and then more and more, and it's still to this day is that way. But that was such a surprise. The bodies were piling up so fast in the refrigerated trucks and the like that people had to notice it, the black and brown excess in that. And so that was a big way of revealing that opportunity is not equally distributed in this country, that risk of exposure, exposure to risk and all of that was not equally distributed. And so many people all of a sudden understood that racism is structuring differential opportunity, and then even in terms of how people were treated, differential valuation. So that was one thing. But now, and let me say, if you go back in your timeline, the moment that we started understanding the disproportionate impact of COVID-19 on Black and Latinx and, Indigenous and Pacific Islander, Filipino, like depending on where you were in the country, who was the most impacted, but all people of color, right?
Yes.
When we started recognizing that in mid-April was the same time that the 45th president said, well, we got to reopen. Free Minnesota, free Michigan, free Virginia. If you look at the time, it was that because the interpretation was not that it was differentially impacting people of color, but that it was only impacting. Or even if it was differential, maybe they were all right with a few white folks getting it as long as it was differentially impacting other people of color. Now, and so even all of the reopening, the banning of mask mandates, all of that was premised not on the fact that we are all human and that this virus is coming through our garden, but recognizing that those in the poor rocky soil were at higher risk of being impacted by this virus, right? And some people interpreted it that was only, they didn't even think of it as poor rocky soil. They thought of it as pink flowers. See, this is the thing. This is the thing between social class and race. People don't understand that it doesn't just so happen that people of color are in the poor soil, right? It's the gardener's initial preference for red over pink that put them in the soil. And then people interpret the limited height of the pink flowers compared to the red as being something innate in pinkness. This is the whole problem with us not recognizing racism as the issue, the differential soil, the flower boxes, keeping the soil separate, the preference for red over pink, but thinking that it's something about pink flowers and red flowers. So we have not recognized yet. It's only now with the Delta variant coming through and a lot of the people who are still not fully immunized being people who bought the 45th president's line that there was no COVID, that whatever, and that people were trying to infringe on their freedom with wearing masks or getting a vaccine. Now that those people are dying in higher numbers than they thought they couldn't get it, now you hear some of the leadership from those states and from those cities stepping up and saying, please go get the vaccine. So all of it, yes, we're all flowers, or we're all human. Yes, we all were equally vulnerable, but the way that COVID came down, and the reason we saw the disproportionate impact on people of color was twofold. We were more likely to get infected because we were more exposed and less protected. And then once infected, we were more likely to die because were more burdened by chronic diseases with less access to health care. And none of those four things, being more exposed, being less protected, being more burdened by chronic diseases, or having less access to health care, none of those has anything to do with our race and everything to do with racism. I can go into that. I mean, you can probe me or I could just keep going. But understanding that the disproportionate impact of COVID-19 on communities of color was not because there's some biological differences. It is not because people of color were running into the storm. They were being pushed into the storm, if you will, without the protection. It has everything to do with racism.
Dr. Jones, you've had vast experience in and out of multiple arenas. How are we impacted by what's happening at the level of healthcare systems, insurance companies, personal decisions that are made by people who bring an implicit bias to the table with these things? I mean, it seems to be present at all levels of what we have to deal with.
Yes. So implicit bias, which, you know, a lot of people are very interested in understanding that, measuring that now. That's a real thing. I actually, with the National Academies of Sciences, Engineering, and Medicine, was co-chairing a very interesting two-day panel on the science of implicit bias, implications for law and policy. And so for people, it's available for any of your listeners and viewers who want to go into that. That was amazing. But the first thing I want to say, besides acknowledging that implicit bias is real, is that many people use conversations about implicit bias to avoid conversations about racism. So I'm telling you, this is the truth. And so then they have implicit bias stuff and all, which is all in the psychology. And then people are like, oh, well, some people are like, well, if it's implicit, then I guess I couldn't do anything about it. Or then, you know, or they get trained to slow down, because sometimes, you know, people show that if you slow down your decision making, if you're a police officer, do you reach for your gun? If you slow that down, then you're implicit, you can kind of damp down your implicit bias assumptions that what is in that black person's hand is a gun when it's actually a cell phone, versus what is in that white person's hand, and you interpret it as a cell phone and it's really a gun. I mean, you know what I'm saying? Like, so yes, implicit biases exist. I want to say that it's good to work on racism at all levels. It's good to have people recognize that implicit bias exists, and not only exists, it exists in them. It is good for us to try to put in safeguards so that people are not acting on their implicit biases. That is, to have, maybe instead of letting people act out their implicit bias by not having guidelines about application processes, or, you know, that kind of, to put in those kind of guidelines so that people are not just reproducing in their industry or in their class or whatever it is, people who are like them, who make them feel comfortable, right? Which is a lot of what happens when you have, when you're not intentional about equity and diversity, equity, inclusion, and all of those things. But the worst impact of the implicit bias focus to me is that people think they're talking about racism when they're not. Racism occurs at the three levels that I talked about, but racism is a system of structuring opportunity and assigning value based on the social interpretation of how one looks, which is what we call race, that unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of the whole society through the waste of human resources. And it is insufficient to just talk about implicit bias, or just talk about diversity, equity, inclusion, or just talk about disparities or disproportionalities, or just talk about cultural humility or cultural competence or structural competence or race. It's fine to talk about all of those things, but if we do not also talk about racism in our national context of widespread and deeply held racism denial, we're complicit with that denial. Implicit bias is not racism. Racism is a system of structuring opportunity and assigning value. And we must talk about it. Let me just say why we have to talk about it. Because if you don't name a problem, you will never be able to start solving it. Naming racism is the first of actually 3 tasks that I outlined for a national campaign against racism. We need to name racism. We need to ask, how is racism operating here? And then we need to organize and strategize to act.
Dr. Jones, this has been outstanding. I can't think of a more timely subject, which is always timely for us to deal with this issue, but thank you so much for sharing your expertise, especially with our local audience here, being a homegirl. We just love having you on the program. We will follow up and do this again. Thank you so much.
Thank you.
This discussion has been fascinating. Our guest has been public health specialist and family physician, Dr. Camara Jones. Thank you for watching. I'm Dr. Lonnie Joe. Take care and stay safe.